is Dr. Tunney. I am a family medicine physician and I work with Mount Sinai, and I'm in the Mount Sinai Brooklyn location. So your primary care physician should be your kind of go-to physician. So even if you're somebody who has, multiple specialists like a cardiologist, a gastroenterologist, you should still have a primary care physician, which is someone who you can call if you're not feeling well, or if you've hurt yourself, or if you need advice. And they also will help direct you in terms of the screening things that we recommend people do, like lab work and cancer screening, things like that. I think that having a primary care physician is really important for your general health. I think there's many reasons why you should have a primary care. Obviously, I'm a little bit biased because I am one, but genuinely, the primary care is almost like a control person for your health. So when you are not feeling well and you go to your primary care, first of all, it should be fast. It should be much faster than you going to the emergency room or urgent care. Second of all, they should know you. So they know your medical history, they know your medications, they know your personal circumstances, which really helps to make good medical decisions for patients. The other thing is that if you're calling in regularly because you're sick or because there's something wrong, your primary care, if it's the same person every time, will notice that and will say, oh, you've called in 3 times for the cough in the last 6 months, so things aren't getting better. We need to look into this more. Whereas if you don't have a primary care and you're going to an urgent care or an emergency room, you might be seeing a different doctor every time. They might not have access to your medical records. And so that's how things get missed, like more sinister diagnoses or diagnoses that if they were treated appropriately would improve your quality of life. So I think it's really important to have somebody who knows you well. We're also realizing more that, your personal circumstances, your stresses, how you're living, where you're living, what you do for work really impact your physical health and your mental health. And so developing a relationship over time with your primary care doctor is very valuable, I think, for your health. Also, you need someone to help you keep track of, when your labs are due and when your pap smear is due and when your colonoscopy is due, because that's a lot to have responsibility for on your own. And so having a primary care helps with that too. Yeah, of course. So primary cares are either typically internal medicine or family medicine. I'm family medicine, which means that I can see everybody in the family, which is something that I really like to do. And it's nice to get to know families as a whole over time. But so family medicine basically can see kids, teenagers, adults, both men and women, can see older patients as they get older, and also can do gynecological stuff. So things like your pap smear, STD screening, IUD placement, contraception, things like that, family medicine can do, which is what I do. And we can also do other things that are helpful, like if you cut yourself or injure yourself, we can do suturing in the office, and we can do some other basic procedures that help. So family medicine is a little bit, just a little bit broader, I suppose, and so has a little bit of other benefits as well. So that's really important, and that's another reason and benefit to having a PCP, is that you need somebody to be coordinating your medical care, especially if you have more than one specialist. And as you get older, you do tend to have more than one specialist. And so it's helpful to have somebody who is kind of coordinating from the center all the different specialists together. And usually how that happens is in a couple of different ways. Either we all have access to the same medical record, which is happening more frequently as clinics and hospitals are all beginning to use the same electronic medical record. So there is that aspect of being able to, look at a specialist's notes or their recommendations without directly talking to them. But most of the time, the communication between specialists and primary care is by email or phone call or text message or messaging system, something along those lines, where the primary care and the specialist can just talk to each other in a normal way and ask questions about the patient, get updates about their care, what the plan is, how things are going. And so there is typically ongoing active communication between them. So telemedicine, I think that it has had, with the COVID pandemic, there was no alternative. And I think there is some benefits to it. It helps us to see patients who otherwise may not be able to come into the office, which is good. So I think there is benefit to it. I think that it is hard in some circumstances. It's very difficult to evaluate a patient fully when they're not in front of you, because a lot of what doctors do is touching the patient, examining the patient, and using some of the tools we have in our office to evaluate the patient. So that's lost with telehealth. And there is an age group of patients that like telehealth, and then there's an age group of patients that don't. So I think that there's definitely good and bad to it. I sometimes don't know if telehealth is a good thing for patient-doctor relationships, if it's harder to build it with telehealth, or if it's more of a if it's an advantage. It's hard to know, but I think there's good and bad, and I think that telehealth certainly has a role moving forward, because there are patients who just can't get into the office. But I do think that bringing patients back into the office now that we're able to, with the pandemic slowing down, that I think that's also a good thing. So that's a really good question. So typically how that situation would work is that the patient who is seeing an oncologist for cancer, they would be seeing their oncologist for that specifically, and the oncologist would be managing their treatment plan and their treatment modality, whether they're doing radiation or chemotherapy. But they would still need their primary care provider to help them with everything else. So their oncologist will only manage the cancer, and they still are going to have other medical issues that need to be managed, and they still from time to time are going to get sick or they're going to be injured, and so they'll still need another point of contact. In addition, the oncology and any specialty work together with the primary care, and that's why it's important to get to know your primary care, because as specialists make decisions, and especially oncologists, knowing the patient is important, and knowing what is important to them, what they value, what their other medical conditions are, and what support they have at home. So while a primary care might not dictate what treatment the patient would have for cancer, that would be more the oncologist. The primary care might give input such as, is this going to be feasible for the patient? Or if they're going to be doing chemotherapy once a week, how is that going to work in their family circumstances? And they might help try and arrange that with the oncologist, or kind of try and see how best it can be facilitated. If a patient is looking for a PCP, I think they should definitely get one as soon as they can, because there's a lot of benefit to having a primary care. I think that it's important to find a primary care that you like. Um, I think there's certain doctors and certain specialists that it's really important that there's a personality match to a certain extent. And I think primary care is one of those that it's important that you like your primary care. And that you feel comfortable with them, and that you feel comfortable, opening up to them and telling them things that, might be uncomfortable or private or awkward. Um, so I think it's really important that you do have a connection with them, and you do think of them as somebody who you can build a relationship with over time. And so I would say that if you are looking for a primary care, look for somebody who you think would be a good match for you. And then if you go to meet them and in the office and maybe they're not such a good fit for you, definitely give it a few visits. But if it doesn't work, there's no problem with going on and looking for somebody else. I think the more important thing is that you like your primary care, you trust them, and the personality is a good match. And I know as a doctor that there is no problem with you going to a different primary care physician that suits you better. We just want you to have medical care and have a good primary care and have a good primary care relationship. And so there won't be any offense or anything like that if there's any issues. You just need to find somebody who suits you, who's good, and who you can rely on. And so just look around and see who is available. And if you are somebody if you're a woman, see if you can find somebody who also does gynecological stuff like family medicine. And so yeah, just look around, but definitely get one because they're very important.